I think that the way that I prefer to explain it to people when we first meet is there's not one single answer, like everything that we know in life. But the issue with us all having this combined passion, I think, which is we want to age with good longevity, but we want to be aging well and aging better. And I think it gets scary to age when sometimes we look around at the general population and how everyone's aging, and that's why we're kind of afraid of aging, right? But if you look or can visualize what aging well can look like to you as an individual in your relationship, and which is what different variables are part of, one of them being bioidentical hormone optimization or restoration. Suddenly that vision of growing old, whether it's yourself or as a couple, gets less scary. I think that maybe we weren't meant to have such a rapid decline and become so symptomatic with hormone deficiencies at the age that we do, especially in Western civilization. But the fact of the matter is, look around you and it's what happens. We get to a certain age, whether it's prematurely via surgery or at the chronological age, and you see this sudden drop off with respect to vitality, energy, sexual satisfaction, which is a huge part of aging well, been very well proven, an increase in inflammation, chronic disease, cancers, depression, brain fog, etc. So that's not a coincidence. And what I prefer, or the type of demographics I prefer to attract into our home, our tribe, if you will, at Dr. Ann All In, is that I want to attract the demographics of like-minded women and couples that get what I'm saying, which is let's just do something to help to restore the deficiencies that we're obviously symptomatic from. And I want them to come because they recognize that they want it. They look around and they see groups of other women and couples that are not aging well and they're suffering. And they're here because I think they say, I don't want to be a part of that shit. I want something different. I want something better, something more for myself. And I think they recognize that bioidentical hormone restoration, since it's such an obvious part of the puzzle that's missing for most of us, is something that could be basically a stepping stone for them to regain their empowerment, their desire for some exploration and fun, their reawakening, if you will, to age better in other areas of their life together and as couples. And when we learn about the education in restoring these deficiencies in ourselves and how they can help to regain this area of life that's very important as women and as men, we realize that, wow, we can open into something that's a huge part of a reawakening for ourselves, again, as one part of a platform to age better together.